You're listening to Talking Points with Preferred Health Magazine. On this amazing show, you get a VIP look at interviews with some of today's beloved celebrities, book authors, top physicians, and leaders in the healthcare industry. So stick around, you're not going to want to miss what's next.
My name is Dr. Farzan Gorgani. I am fellowship trained in oculoplastics and reconstructive surgery, and I also perform cataract, cornea, and refractive surgery. And I'm working at the New Jersey Eye Center, Della Russo Laser Vision in Bergenfield, New Jersey. Sure. So Botox, the purpose of it is to actually paralyze the muscles of facial expression. So as you age, the face descends with gravity. The collagen attachments from the skin, the muscle, and the bone, they start to weaken. And so as you contract the muscles of facial expression, so the frontalis muscle, which raises your eyebrows, and causes the horizontal wrinkles, and the orbicularis oculi muscle, which is the circular muscle around the eyes, which causes the crow's feet. Over repeated use throughout your life, they can cause wrinkles because of the perpendicular movement between the muscle and the skin. And so that's why you get the horizontal wrinkles on the forehead and the crow's feet around the eyes. And so what Botox does is actually literally paralyzes the muscle or reduces the activity of the muscle. So you're not getting that contraction and the skin doesn't show the wrinkles. The Botox works really well for something called dynamic wrinkles, which are the wrinkles of movement. It doesn't work well for static wrinkles, which are wrinkles that are always there. Sure, yeah. The most common muscle that could be negatively affected is the levator muscle. So if you inject Botox too much or too close to that muscle that controls the lifting of the eyelid, then it can paralyze that muscle. It's a small muscle that raises the eyelid. And so if you get Botox on that, the lid will actually droop. And the effects of it can last up to 3 months. So I try hard to avoid that muscle by injecting outside the orbital rim, and injecting away from there. But I've seen it before. It definitely is possible to get Botox creep into that muscle and paralyze it. Okay. Right. So the Allergan brand Botox that we have, it lasts between 3 to 4 months. So we just ask patients to come back every 3 or 4 months. Different brands that do last longer. They're more expensive, but they do last longer. If someone's interested in that. The 11s, which are the lines that occur when you bring your eyebrows together. The crow's feet around the eyes. You can also do something called a lip flip, which are 6 units around the lips, really small injections. And what that does, it actually flips the lips up and actually makes your lips appear fuller without having filler treatment. Okay. And there are a couple of spots around the jawline to give your face a more heart-shaped face. Get Botox because they know, especially people, light-skinned females, because they're more prone to getting sun damage and wrinkling at a younger age than someone with darker skin. So yeah, I've had patients in their 20s come because they know it's preventative, and it is preventative because if you're preventing that constant motion of that perpendicular motion of the muscles against the skin, then you will prevent wrinkles in the future. I do tell them though that it also for them to have a more youthful look as they get older, you do need a skincare routine. So that includes SPF, it includes gentle cleansers, it includes antioxidants, and if there's no risk of pregnancy, retinol as well. So retinol on the skin, so all those things put together. So a gentle cleanser that doesn't irritate your skin, like none of those like apricot scrubs or plastic scrubs, all that stuff causes microabrasions on the skin and irritates the skin and causes inflammation.
Mm.
So I avoid that. So a gentle cleanser at least once a day, and then SPF, which prevents sun damage to the collagen proteins in your skin. Antioxidants, which absorb the free radical formation from the sun. Moisturizers that help the skin have its moist barrier. And then retinol at night, it helps turnover. So it helps the cells turn over the dead skin cells. So you have a more youthful, vibrant look. That's a pretty good skin routine. I tell that to younger patients and older patients too. Fillers, it depends on the product. There's different products that have different ingredients. The most common one are called hyaluronic acid, and it's actually a natural lubricant in the joints in your body. And the reason why that's used is because it absorbs water. And so when you inject, and there's different viscosities and densities of it with the different fillers that you get. So for example, there's Juvederm Voluma, which you inject around the cheekbones for a more lift. That's a denser concentration of the hyaluronic acid, and it gives more support. For areas around the lips, nasolabial folds, and the marionette lines, those are more dynamic areas that move more. So you need a less dense, a more viscous hyaluronic acid. So the point is that when you inject it, it absorbs water, and that makes that fills the area. So it also depends on the product, but usually a year to 18 months.
That's great.
There are side effects, and we take great caution to prevent these side effects. So one of them is granuloma and inflammation underneath the skin, which can manifest as lumps and bumps under the skin where the injection was, and redness and irritation. If that's the case, then you would either dissolve it, or if needed, you could surgically remove it. Not the most desirable thing for a cosmetic patient.
Sure.
It's very important for the someone doing these injections to know the facial anatomy. And the reason why is because there are danger zones. If the filler gets injected into a blood vessel, it can cause, at best, local skin reactions. So that's just redness and irritation of the skin. It could get worse to actually skin necrosis. So skin cells dying and becoming black and falling off and then having to regrow again, and scarring. The worst thing that could happen is blindness and stroke. So infections under the skin too. So infections can be treated by either removing the filler, or dissolving them, removing it, or treating with antibiotics. You have to avoid the blood vessels. So every time I inject, I try to aspirate a little bit to make sure my needle is not in a blood vessel. Even by doing that, you can still inject into a blood vessel. And what happens is, if you inject into an artery, that filler can get pushed back into the arterial system and go up and cause a stroke, or cause a stroke of the eye and cause blindness. I've had experiences where people come from med spas or from other countries, and they need me to fix whatever happened. It happens. Again, you have to go to someone that you trust, someone that has experience, someone that has good reviews, and has the correct training and education. It may not be worth it to save a couple of bucks because it's your face.